Hello, my name is David Delgado, and I am here to inform you about Lasik eye surgery. Never lose an opportunity of seeing anything beautiful, for beauty is God's handwriting. Ralph Waldo Emerson. Do you wear contacts, glasses, or find yourself squinting to see a street sign or the board in class? Well, what if I told you there's a solution not only for you, but for everyone out there with the same problem? This presentation will explain what Lasik is, the benefits and risks, who is eligible, and a step-by-step through the procedure. Last year, I researched this topic extensively prior to receiving my own Lasik eye surgery in El Paso, Texas. Now, first, let's begin with understanding what Lasik is. Lasik is surgery that permanently changes the shape of the cornea. It is done to improve vision and or reduce the need of glasses or contacts. Lasik is an acronym, and it stands for Laser Assisted Sit-to Keratoomyolusis. To be eligible for Lasik, you and your eyes must be in healthy condition, and your prescription must be stable and in the range that can be corrected. Those who suffer from chronic dry eyes, glaucoma, and or immune disorder are not eligible for the procedure due to health. All procedures should be discussed with your optometrist prior to surgery. Now that I've discussed what Lasik is and who is eligible, I will now be discussing the risks and benefits of Lasik eye surgery. Some of the risks and side effects of Lasik include overcorrected, blurred, or loss of vision, difficulty while driving at night, light sensitivity, dry eyes, discomfort, and very little pain. Benefits include corrected 20/20 vision with a 97% satisfaction rate, better lifestyle, and freedom from contacts or glasses. Another benefit about Lasik surgery is the surgery is done by the state-of-the-art technology, so you don't have to worry about the Dr. Shaky's hands during the procedure. Now that I've discussed the benefits and risks, I will now inform you about the procedure itself. The procedure process. First, the eye is numb with a few drops of anesthetics. You are wide awake for the entire procedure. An eyelid holder is placed between the eyelid to keep them open and prevent the patient from blinking. The next step is a suction ring is placed over the eye and lifts and flattens the cornea to help keep the eye from moving. Once the cornea is flattened, a hinged flap of cornea tissue is created using a microsurgical blade. This cornea flap is lifted and folded back. The laser is pre-programmed with the patient's unique eye measurements and centered above the patient's eye. The surgeon checks the laser and the correct position. The patient looks at a special target light, while the examined laser sculpts the corneal tissue. Then the surgeon places the flap back into position and smooths the edges. The corneal flap sticks to the underlying corneal tissue within 2 to 5 minutes after the procedure is done. The surgeon will provide eye drops for healing and to prevent dryness in the eye. Now that you can see that Lasik is beneficial to your life, I will conclude with that astigmatism, myopia, and heteropia, or farsighted and nearsightedness, has been changed entirely due to this revolutionary technology created. But before you get your surgery, be sure to weigh the risks and benefits and consult your doctor. Then get your procedure done today. Because beauty is in the eye of the beholder, so look clearly to the future. Now here I have some visuals. We have the eyeball that has been cut with a microblade and flipped open. That's the corneal lens, and the laser is being applied to take off and reshape the cornea of the eye. Next, we have the operation table. Here you see, this is where the patient lays with the head over here. This is the laser machine where the laser shoots out into the eye and the doctor programs it up here up top. Now, do we have any questions? Yes?
Are you asleep during the procedure?
No, you are wide awake for the entire procedure.
Oh.
Yes. Any other questions? Yes, ma'am.
Is it a scary procedure or is it pretty quick?
The procedure itself takes about 5 minutes for both eyes. It is a scary thing. I did do it by myself, and I was pretty scared, but I mean, after it's done, I don't regret it at all.
So do you think it is beneficial for someone? Would you recommend it to someone?
Yes, I highly recommend LASIK eye surgery for anyone that's looking into it or having trouble with their contact lenses or glasses. Any other questions? No? Okay, thank you guys.